Well, welcome everybody. I think we'll get started and people can as they join can add their name and info to the chat. I am Melissa Jones. I'm the executive director of Barhi. I'm here today with Dr. Wilson, and we're here to host an informal conversation and dialogue about getting to the heart of it all, how community leadership reshapes systems and institutions. And it feels like Dr. Jones set us up really well to start that conversation. We'll both tell you a little bit about who we are, and then we'll jump into some reflections from Dr. Jones, and then move into a broader dialogue about this particular moment in time and how this initiative can serve as an incubator for community-based work to flourish. So I will say I'm Melissa Jones with Barhi. Barhi, for those of you who haven't met us, is the coalition of the Bay Area's governmental public health departments. We're located in the San Francisco Bay Area, which includes the cities of Oakland, San Francisco, San Jose, and then in 9 counties, many of which you might not know the county name of, but would recognize the cities and towns. We're the coalition of the governmental public health departments that we're looking at differences in life expectancy by race, zip code, and class, and formed a coalition specifically to work on the issues that were driving those differences outside the doctor's office. And so we work really intensely on the issues that impact health that aren't healthcare. And so we work on housing affordability and health, economic justice, environmental justice, and climate and health, with a real lens towards transforming the living conditions that create health and building power with community to do that. As part of that, the Bay Area's long tradition of strong community organizing groups partnered with public health departments were able to get 100% coverage of COVID-19 eviction moratoriums before those moratoriums passed anywhere else, able to pass some of the strongest anti-rent gouging legislation in the country to keep people housed pre-pandemic, and have done things like expanded statewide paid sick leave and other important initiatives for health. I want to give Dr. Wilson a moment to share a little bit about who he is before we jump into a conversation about who we all are.
Hey, I'm Dr. Sacoby Wilson, University of Maryland College Park, direct the Community Engagement Environmental Justice and Health Center. We want to call that soon. We're going to be launching it as a center next month. I primarily do work with communities, environmental justice work as my focus, really look at these issues of environmental racism and how racism is the root of all causes, in my opinion, of most inequities in this country. So how communities are fighting against being used as sacrifice zones for whether it be refineries in Richmond, California, goods movement issues in Oakland, California, to petrochemical operations in Cancer Alley in New Orleans, to industrial hog farms in North Carolina, industrial chicken farms in Maryland, and really across the continuum of climate impacts that folks of color, low-wealth populations are the ones that are disproportionately impacted. So we're working on stormwater issues, green infrastructure issues, building geospatial tools to map environmental climate injustice, doing a lot of work really, folks in areas of what I like to call liberation science and empowerment science. Not doing science about extraction, doing science about action. Folks who are in impact in the front line, fence line don't need more data, don't need more studies. They need solutions. They need us to fight against colonialism, scientific racism, and scientific imperialism. So making sure data is about power, data is about people, data is about justice, and data is about change. So that's why I'm here, and I'll be quiet. Thank you.
Thank you. And so let's get right into what Dr. Jones was talking about. And we want to invite you to share the reflections you've had since hearing her speak. Reflections on the 3 allegories she shared, reflections on action, reflections on how this moment can push us differently into the work that's next. And so if folks want to either raise their hand or put into the chat the comment, we're going to try to bring you into the room with us to start that conversation. You can share your audio and visual to join the conversation, folks. So
what do they share at? Should be buttons for you to share.
Thanks, Stasia. Let's see what we can figure out here. There should be some buttons on the underneath the videos you're seeing on your screen. There should be 4. Is that right, Jamie? Could you share a little bit about how they hop into the conversation? Fantastic, Stasia. I see you, so I'm going to put you in, and then Jamie said, click the blue button at the top right corner of the screen to join. So we've got Stasia and Jamie. Thank you for getting us started. And I think you just need to unmute yourself.
There we go. Yeah, new technology and conferencing. It's always new to get used to. So, Camara Jones is always wonderful. And I find her stories to really help to illuminate and drive things home. I think some of the questions that came through were along the lines of where I'm going to in terms of my thoughts. A lot of times I'm hearing conversations about structural racism and separate conversations about social determinants of health, separate conversations about environmental health and justice. And the opportunity to weave them together, there's some conversation. I think Camara Jones did an excellent job of connecting social determinants of health and structural racism. But I'm still feeling that environmental health factors and environmental justice factors are not seen as integrated, or that narrative that integrates the 3 is not yet something that is comfortable for most people in conversations. And so I'm wrestling with that after hearing her talk.
Yeah, thank you. What part of it feels missing, or what do you think the connection would be? And others, if you want to join the conversation, please press your blue button.
I think for me, there's assumptions made when we talk about social determinants of health. When that term was new, it sort of got defined in the public space in various ways, and there's a general understanding of what's included in social determinants of health. And environmental factors are not usually in that general definition. So it's going to take some work for people to see that things like air quality, where industries are located and positioned in communities that are being supported by healthcare, being supported by other entities, raising that as a real example of structural racism and a factor that's underpinning many social determinants of health is something that I think needs to be explicitly stated to redefine the concept of social determinants of health so it is fully inclusive of those environmental factors. That's the only way we've been grappling with it, but I'm open to other ideas because I think it's something that needs to come from many different angles. And I know from our work, many of the impacted communities, environmental justice communities, have been working on this for a long time and haven't been heard. It's sort of like a separate conversation that hasn't been seen when, they might be advocating for access to healthcare. It's separate from their advocacy around ensuring that they have healthy air to breathe and safe water to drink. So.
Thank you.
Yeah, I would say that Dr. Bunyan Bryant, if you look at his definition of environmental justice, which I think he stated in the mid to early 90s, you can experience your highest potential without experiencing the isms. Access to paying jobs and safe schools, quality recreation, good jobs, and healthcare. He framed that in the early 90s. So for me, environmental justice is really, as a framework, is talking about environmental terms of health and health equity. That's always been the case. EJ, frontline, fence line folks have always framed it that way. I don't think it's their problem. It's the discipline problem. It's you said the comfort level with talking about racism. I did a story for BET on lead issues in Baltimore, and I said it's racism, racism, racism in my comments. So I'm not sure. I think it's more of the culture of the agencies who were engaging those communities and their lack of comfort, not the lack of comfort in the framing from the communities when it comes to these issues. Yeah, I think it's more of the cultural issue. So we have to change the culture of the institutions and the cultural norms so people will actually understand that racism is a determinant of health. And whether it be, economic racism, environmental racism, You know, you can go on and on. Medical racism, it's all the same system, right? So I'll stop there, but I think we have to change institutions that are engaging those communities and let those communities lead the work, and I think that'll help also change those cultures. Yep.
Yeah, and I'll clarify
just as a quick,
and then step off so others can talk. Yeah, it's just that
go ahead.
I absolutely agree. I was not stating that the communities have it incorrectly, but rather there seems to be a blockage in the sort of general narrative by whether it's institutions or the general community of talking about social determinants of health. So so I would agree.
Academia, the same thing. Mm-hmm. We want to all of a sudden all academic institutions will be anti-racist. Like, where you been at? What have we been doing in public health? So I agree with you with that. Yeah, thank you for sharing. Go ahead, Melissa.
Yeah, that maybe that takes us a bit to what this conversation is about. So they've asked us to share a little bit about our work and then to kick off a conversation. And so I'm hoping that maybe a slide can be shared on the Barhai framework. There is certainly a difference between what we're hearing communities talk about and what's being talked about inside institutions. And I think the power of this moment is there have been now for decades people inside institutions pushing an agenda around racial equity, economic equity, social justice, sometimes heard, sometimes unheard. And I think the alignment and energy of social movement right now is forcing those conversations inside institutions. And it makes it a very important moment for us to be talking about how community leadership can reshape our systems and institutions. And in fact, how it often has. And so I wanted to share a little bit about the work that we've been doing in the Bay Area in California and talk about the Adapting to Rising Tides initiative that we've done here, but talk not so much in detail about the initiative, but how we've seen investments in community institutions matched with long-term partnerships with government, helping to build power to gain more wins over time. And so the Adapting to Rising Tides initiative in the Bay Area was focused on doing planning in a handful of sites around rising tides infrastructure. It was an opportunity for communities to really have resources to use their expertise to engage in community planning. And Barhai and our public health partners worked to develop actually a lot what you're talking about, Stasia, a way to think about community need that thought both about health equity, economic justice issues, and environmental issues together, and encourage communities to do that planning in the way a community would approach planning, which is around the multiple things people need for health, rather than the narrow system lane that a particular planning process might fit in for communities, or for a particular planning or institutional process. And during that planning process, we worked with the community groups to ensure that they were financially supported to do that work. We worked with the institutional partners to understand the highest leverage ways to partner with community to help them figure out a role that fit for them, but left community in the leadership role. And we're able to get a number of priority planning projects prioritized and put onto an agenda. But more important than that, we were able to use that set of relationships that were forged there to start a conversation about a major planning process for the Bay Area that's Bay Adapt and happening now. And we used it to pilot a whole series we have a report that's forthcoming shortly that'll be shared with this full group that talks about the set of strategies needed to really honor the expertise of community groups for money and finance and planning processes, and to establish processes that would approach an issue more in the way a community would and less in the way that is forced by a sort of narrowed community planning process. So that has resulted in the expansion of the regional planning process around shorelines to include much deeper community engagement, fully resourced, and the beginnings of a process that help think about how public health departments and community groups are more resourced to do work on climate change and equity. These are the kinds of pieces we think are important in sort of small step operational planning for institutions, but can build on the energy of the moment. Dr. Wilson, I think one of the things that Stasia raised for me that I thought was really interesting is I actually think the Green New Deal, the just transition, some of these conversations that are happening that are integrating the idea of economy, environment, housing, social justice are really clear frameworks and manifestations of what could be next. Can you talk a little bit about how you see what's emerging, the possibilities that are emerging in this moment?
Oh, yeah, thank you for that. Earlier when we were talking before we got started the session, I had my headphones on because I'm listening to the first White House Environmental Justice Advisory Council meeting. As part of that meeting, Vice President Kamala Harris provided some comments via camera. We had the CEQ, when the CEQ second in charge, Cecilia Martinez talked, but a big part of the discussion was on Justice 40 recommendations. Dr. Shalonda Baker from the Department of Energy, the first Energy Justice Department, and Assistant Administrator Justice Department, at least the head of the Energy Justice component of the Department of Energy, and some others spoke about Justice 40. And the whole idea behind Justice 40 is 40% of the benefits when it comes to addressing climate change and environmental justice will go to frontline and fence line communities. So you're exactly right, Melissa, that you see this intersection now of investing in, green infrastructure, investing in renewables, electrification, addressing workforce development opportunities, and creating opportunity structures for your communities, but at the same time addressing some disparities in access to infrastructure, because that's a big part of that discussion as well. So energy infrastructure, housing infrastructure, food infrastructure, healthcare infrastructure. You saw by the recent stimulus package, the previous stimulus package, right? So I think the moment is now, and I would say that President Biden is only the third president in history of this country is actually focused on racial justice. That's pretty sad. We have 46 of them: Lincoln, LBJ, and President Biden. So I think that energy is there. This WEJAC meeting that's happening right now it speaks to that, and the fact that you've had stimulus packages to get at some of these issues related to the pandemic and those underlying root causes to make some communities why they were overburdened in the first place, why they've been disproportionately impacted by the COVID-19 pandemic due to other things they've been already dealing with, getting back to the point about root causes. So there's a lot for us to connect to, and there's a lot of intersectionality. And I think, we as a group here have an opportunity to engage our community partners and some of this community-led work and make sure those resources and investments get to them. I think there's a place for us to play because it's about where the dollars are going. How are we actually divestment, disinvestment has led to some of these problems. So these resources have to be, really focused and micro-targeted to a lot of these communities that we work in and community partners who we work with.
Mm-hmm. So there's a lot of attention right now to the COVID relief dollars, that first package that's come through, which is a huge package. And I think everybody's eye is on this idea of an infrastructure package, which we expect next.
Potentially 4 to 10, was it 4 to 10 trillion?
Mm-hmm, mm-hmm. Yeah, and so we've been, so at Bar High, we've been supporting, health departments are on the front lines of response on a whole lot of climate disasters, including the wildfires that we keep getting hit with year after year here in the Bay, shoreline and flooding issues, and then issues like COVID-19, right? And it's the range. And so we host right before fire season. And so yesterday we hosted a conversation about co-occurring disasters following on a conversation we had done the year before to really help for planning and thinking about how to strategize for the new season that's upon us. And we really started talking yesterday about 3 kinds of infrastructure, right? The infrastructure that is the way sort of climate scientists sometimes talk about the buildings and built environment and what they call infrastructure hardening, right? The sort of getting infrastructure ready. We've talked about it for COVID too, about putting up, having the right HVAC system, putting up screens between people, those kinds of things. But there's also the people infrastructure. That is what we've seen really work in COVID response, right? The people who are trusted messengers who get word out about testing, who get word out about COVID, about masks, about now vaccines. those networks that have responded when people needed food, when people needed a whole range of things during COVID. And we have the work of institutions, right? That many of you, it looks like, are here from on the line. We see a number of foundations, a number of others. What do you think the mix is for the kind of infrastructure we need to really dig ourselves out of this incredible level of structural racism and economic and environmental injustice?
And what are the role of your community partners and that's right.
Yeah, directed to the full group of almost 20 of us. So please feel free.
Yeah, please jump in use the button at the bottom. Was it the green button at the top corner to join in? I don't see the green button on my side, so.
Yeah, we have a different screen than you all, but she said a blue button should be able to.
Yeah, so if you want to chime in, answer those questions, please chime in. I'll stop talking, sorry.
Can share your audio and video. We can have up to nine folks on the screen at a time. Okay, Katie, we're bringing you onto the screen.
Hey, everyone. I'm out. It got so nice outside. I had to run out and take advantage of some nice weather. But Sacoby, working in healthcare, I think, besides the, obvious infrastructure pieces around money going to communities, we also need funding within healthcare to help us bring in more Black, Brown, Indigenous folks into healthcare, whether it's nursing or medicine. We have a real problem in this country that the folks taking care of people don't look like them. And, there's definitely, it can cause lack of trust, so many different problems within the healthcare system that I think, having some funds going to help bring in more of those folks into healthcare. So I think it's going to be a huge issue. And also I think related to COVID, we're going to have a massive amount of healthcare workers leaving the workforce. And so we're going to need to be thinking about that. I think a lot of them are going to have PTSD and just be like, I'm done. So, this could be a really great opportunity to help replenish that workforce.
Yeah.
So as a quick response to that, I think on the back of what you said, the PST is really important. Like frontline workers when they're COVID-19 pandemic, a fire, right? Hurricane event, a flood event. What happens to our emergency workers, right? When the care that they need, right? That's an issue. But then your point about the workforce development part and the training, part of the issue is, and this is to you, Katie, and maybe the rest of the group, but when you're not training that many doctors of color, nurses of color, I have 3 nurses in my family, right? How do you address that training gap, right? I'm sorry, go ahead.
No, I completely agree. And, I don't know what the solution is, but I think that, as they're looking at putting funds into things, like this would be a great area to put some funds into to help bridge that gap.
Thank you. Others?
Yeah.
Go ahead, Melissa.
I see an agreement from Tracy Green at Bar High, who is also a nurse by training and thinks quite a lot about that. Yeah.
Yeah, environmental health nursing. Definitely need more environmental health nurses, right? Others want to chime in? Go ahead, Bernice.
Moving you onto the screen,
Thank
Bernice.
you. So this is so troubling to me, what you're saying about lack of people of color in the health sector. So I come from 4 generations of nurses. My mother was a public health nurse at the municipal hospital in Harlem, where I was born, for 43 years. And my dad worked at that same hospital for 36 years. It was the largest employer of people of color in our part of New York City. And most of the municipal hospitals in New York City, that network of municipal hospitals, employed a large network of people of color, public health professionals and semi-professionals. And what the hell is a semi-professional? I don't know. But my point is that my mother went to work at that hospital when she was 18. And when she retired, she was 62. It was the only job she ever had. She went to nursing school through that hospital. you know, between the union that she belonged to and that workforce, that public health workforce, it was our whole village. It was our whole community. So I'm really disturbed to hear that people are not going into that, still going into that system to serve the needs. And even though there were many other hospitals nearby that had a higher level of care, people always went to Harlem Hospital because they knew that the people there would take care of them, right? And wouldn't let them die. So I'm really disturbed that this trend is not happening. And what can we do about it? And then lastly, I want to say there is, though, this very disturbing practice, and I don't think it's only in New York City, where most municipal hospitals are paired with a teaching hospital. In the case of Harlem Hospital, it was with Columbia University School of College of Physicians and Surgeons and the School of Public Health. And they used to suck a lot of the resource and the expertise out of the hospital, which drained the hospital. And then when we got into a period of public health, of financial crises in the city, it really undermined the efficacy of those municipal hospitals that serve Black and brown people. How do we intercede in that? How do we give community leaders the power to shift that, to make sure that people get what they need? I don't know what that background is, Sacoby. But it was a source of power in our community. We were poor, we were working class. It wasn't, it wasn't like Columbia, it wasn't like Mount Sinai, it wasn't like all the other hospitals, but it was the village. It was the center of the village in our community. And I'm so sad to hear that people of color are not in that space as much anymore, especially nurses.
I see Tracy wanting to join the conversation.
It is disappointing, and as a nurse and as somebody who's I'm also in school, and I just did a paper on the underrepresentation of African Americans and people in the healthcare system, and our advanced practitioners are superbly underrepresented. Black people are 12.9%, I think, of the United States, and yet less than 5% of physicians and psychiatrists are African American. And studies show that African Americans do better under the care. Everybody does better under the care of people that they trust. And so there was just a study that showed that Black babies who are born sick are 3 times more likely to die under the care of a white physician than they are under the care of a Black physician, although those numbers are not reversed if it were a white baby under the care of a Black physician, meaning that it's the same under a Black physician, regardless of for a white baby, regardless of who takes care of the child. Yeah. However, one thing I want to point out is that CNAs and techs and those fields are overrepresented with people of color. So if one of the things that I feel like needs to be done is that we have to start with education and getting our children and our young adults educated in advanced practitioner, because if we have more certified nursing assistants, which I don't have, I started as a certified nursing assistant. If we're overrepresented in the essential worker and low-paying jobs, then why can't we not get to at least the same amount of representation for our doctors, our psychiatrists, and our advanced practitioner nurses?
Mm-hmm. And we see this across industries, across the range of industries, the built environment planning groups, the people working on health. It's such an important issue. Bernice, did you want to join us back? Yeah, thanks, Tracy. That's a big one. Great. We have 15 minutes left for the conversation. Do you want to pose your next question?
Is that for me, Melissa, or that's for
yeah, or Tracy, audience? Do you want to talk a little bit about things that you've seen working?
Things that I've seen working as far as in the healthcare?
Yeah, have you seen any of the pipeline programs that you feel like are really working for this, or not? We're really not where we need to be yet.
I don't think that we're where we need to be yet. I think that it's like with a lot of our other avenues is that people are not recognizing racism in healthcare and not recognizing that there are some um, biases that even people who don't consider themselves, even healthcare practitioners who don't consider themselves to be racist, there's biases that are out there that inhibit the care of African Americans and make African Americans feel like they going into advanced practitioner healthcare is impossible for them. Um, Dr. Jones, her speech was so inspiring, and it really made me think about if we don't invest in African American children the same way, and that we don't, there's no push to say, hey, let's make sure these kids have the math skills and the science skills early on, so that if they do decide by the time they get in high school that they want to go on to college, that they're prepared for pre-med and that type of thing. But as somebody who has worked on the floor, who has worked in the hospital setting, in the healthcare setting, there's so much bias for people of color, whether it be Latinx or African American or even with the Asian culture, that we can't, until we recognize that bias, until somebody actually says that this really exists, then there's not going to be a change.
Yeah. And one of the conversations that is going in the chat as you're talking is right on that point of how do we use the to change that. And I want to talk about two things we're doing here in California, and then maybe Dr. Wilson, if you want to add some things, and folks on the line, if you want to jump into the chat. We've done two things. Here in the Bay Area, we've convened about 1,000 people in the first few months of the pandemic to come up with a really clear plan around what investment strategies should be for the first COVID relief bill that hit what now feels like 8 months ago. The bill we have recently, and we've been training people around those set of strategies. That is a social determinants of health set of strategies that includes climate and health. It's available on our website at www.barhigh.org. And statewide, there's been a new coalition formed that includes public health departments, community health workers, coalitions like Bar High, community-based organizations and advocates focused on issues of houselessness, on issues of racial justice, called COVID Justice, whose job it is to work with lobbyists and others to try to influence the funding, including to community health worker strategies and other strategies that think about the rebuilding of our economic fabric right now. Knowing that 2008 was such a heavy recession hit for communities of color, it took us a much longer time to dig out. Some of the gains never recovered, and we don't want to see that now for this part of the recession.
So I think another question to ask is, as we close, get to the end, how can we together, build power? And Melissa, you have any more thoughts about building power?
Yeah, I mean, I think that this is a moment. This is a big power moment, and that's where all of our attention should be focused. We should be asking for and looking for and advocating for bigger things than we ever have before. This is the multi-generational, 2-generational moment, right? Where all the money that's coming through should be directed to the communities most impacted. It should be directed with a multidimensional lens. And we should, there is so much happening right now. The level of lost wages has highlighted for me, at least in my neighborhood, and I'm sure in many other places across the country, the number of people with incredible talents who, as they were squeezed, started selling new things, doing new things. The entrepreneurial spirit to keep moving and to make money right now is huge, and we should be investing in entrepreneurs of color across this country who are in a moment of thinking about how they're rebuilding their financial lives and digging deep into supporting that and to supporting the businesses that were closed and challenged over the course of this period. And then also supporting the community justice groups that are looking to create what I would call the full population scale change, right? Housing as a universal right, right? The ability to have housing that is affordable as a human right, working on issues of health justice, environmental justice in new ways, deeper ways, more innovative ways at more scale. I think the moment is now, the door is open, and the issue is to push. And I think that public health, I know there's a lot of public health and foundation people in this room as you were introducing yourselves. I think some of what's public health and foundations have looked for, pushed for, felt like they could ask for, the ask is bigger now. And we want to adjust to that moment, and do what we've been building a foundation for now, as a field for decades.
I mean, just to chime in on that point, I mean, on the foundation side, even the federal funding side, I think this from 2015 on the federal funding side, for example, institutions are focused on historically Black colleges. I think that's an example we can talk about, but also other minority institutions. And I think 2016, they received only 3% of all federal dollars, federal resource dollars. That's just one example of inequities in funding. The Donors of Color Network came out, they found a study that said, I believe in last year, or maybe last year or 2 years ago, that foundations, we talk a lot about environmental justice, but out of their total portfolio, foundations were only giving 3% of their total portfolio to environmental justice. That's not good enough. So we have to make sure when it comes to, if we're going to address these issues, we have to invest in the communities. We have to invest in those frontline, fence line organizations that work in the communities. And I think we have to have collaborative partnerships that really seek to build power, expand power, and really shift power. We have to talk about shifting power to our organizations that are in these communities. Because again, from an efficiency standpoint, many of the leaders and the community members, they're the ones with contextual expertise. So they have the solutions that can be really be context specific, right? And really help us get the impact, maximize the impact when it comes to climate justice, economic justice, environmental justice, and health justice. So we have 5 minutes left. Melissa, do you want to close? Or do we want to take one more comment, or do you want to go ahead and start closing out, Melissa?
I'd love to take one more comment.
So who wants to speak to help us close this out, talking about power, shifting power, building power, expanding power, collaborations, success stories that can be scalable, you know, scaling up from San Francisco or Oakland or Detroit or, you know, or Charleston, Kalamazoo, Trenton. You got the floor. For the country a little bit. So anybody who wants to chime in before we close out. So go ahead.
Oh,
Stasia, adding you to
the one thing,
Bernice adding you.
The example that I put in the chat box, we've been working on that for about 5 years. And, a critical lesson learned is that the work to shift power takes time. And a lot of times within the context of our funding work, there isn't that acknowledgement and recognition that when we're changing big systems that have structurally operated a certain way, and now we are bringing them to the table in service to community, to listen, to hear, not to be the leader, but to listen, that it actually takes time to work that muscle, to move it up through the systems and get the acknowledgement from healthcare leadership, so that the systems actually start changing how they operate in service to community, and actually shifting that power. So the example I gave was about 5 years in the making, and we're now getting to a place of actually some active products coming out of that work, but it is a continual and iterative process and a relationship building process.
Great. And Vernice, I think we'll take one comment from you and then we'll do one final word.
I want to build on what Stacey has said. It's also an opportune moment. I have been working in the field of environmental justice and civil rights and racial justice for more than 30 years. And I've not seen a moment when people have thought about, talked about climate justice, environmental racism. People used to run for the hills whenever we would say environmental racism, and now they want to sit and have a conversation at the White House. So there is something happening. The question is, can we make sure that whatever is happening and whatever is blooming stays grounded and rooted in the social movement that bore this, which is a grassroots movement, which is a community-based movement. There are lots of us that support that movement and try to give whatever expertise we have, but it will lose if it doesn't stay grounded and contextualized in that work that is about community and community empowerment and community transformation.
Thank you. And I think that that's our call here. So there are two sets of groups funded through this initiative, a whole range of community-based organizations and coalitions, and then institutional partners. And so I think one of the questions here for many of the institutional partners on this call is what is our relationship and network to those grassroots movement driving partners? And each time we're in a room, how are we understanding our role relative to their demands and support?
Yeah, I think it's important. I don't have to leave yet, so I have a couple more seconds I can stay on. But staying connected to the people's table, right? There are groups on the ground that are doing this work. So how are we connecting to those tables? How are we helping to support those tables, right? Through our infrastructure, through our knowledge, through our networks. And I think this, sort of convening and the work we've been doing speaks to the work locally, but also how we can work together across our networks to bring the bare resources, infrastructure. As Melissa said, infrastructure is buildings, right? Infrastructure is also people. And so I think that's some power there. So not just building power, but connecting to power. Okay.
And this is the moment. And so please, we're going to wrap up now, but please put in the chat if you have specific ideas or specific things we can be doing as part of this initiative to help us connect to the other community partners, players, and movement builders that will drive this work forward over the next 2 years.
Thanks, everybody. Enjoy the rest of the meeting.
Thank you. We'll move to the main stage. There'll be a DJ spinning, I understand.
Yes.
Have a good day, everybody.
Y'all take care.